Hello everyone, I'm Akanksha and today we have Dr. Srinivas Prasad from Horizon Cancer Care, Banjara Hills. He's a senior oncologist and a cancer surgeon. In our country, cervical cancer is a leading cancer among women. So let us know more about it. Hello, doctor.
Hello Akanksha. Hello everyone.
So, what is cervical cancer and why is it so common?
The lower portion of the uterus is called cervix. Apart from many infections, the cervix is also prone for cancer. 70 to 80% of these cancers are caused by a virus called human papilloma virus. This virus infection is very common in our society due to the unhealthy sexual practices. In most, our immunity attacks them and eliminates the virus and they live a normal life. Of lakhs of people who get infected with this virus, only few will develop into cervical cancer, that too after many years.
So, which age group is most commonly affected?
Usually between 35 to 60 years of age.
What are the common symptoms that raise suspicion to cervical cancer?
In women those who are having regular periods, that is menstrual cycles, noticing of any spotting or bleeding in between the cycles, that's an abnormal bleeding, and also bleeding after the sexual intercourse should raise the suspicion. And in postmenopausal women, if they notice vaginal spotting or a new onset bleeding, should immediately raise the concern and they should report to the doctor.
So, can it be detected even before there are any symptoms formed?
Yes. This is called screening test. That means before the symptoms arise. A simple gynecological examination where the cervix is visually inspected and for any abnormalities on the surface, like an ulcer or an redness or any growth on the cervix. This can detect it early. Also, while examining, we gently rub the cervix with a soft brush and collect the sample. That is called pap test. That is visual inspection of the cervix and pap smear test. These two screening tests can detect the cancer in early stages.
So, when should women start screening?
They should start at 20 years of age or after the marriage. From 20 to 30, it's done pap test, they should do it every 3 years. From 30 years of age to up to 60 years of age, the liquid-based pap smear test is done every 3 years. If we add virus detection test, that's called HPV co-testing, the screening test can be done every 5 years. Beyond 65 years, every year they should see the doctor to have a routine gynecological checkup to detect any abnormalities.
If a woman has developed symptoms, what tests should she get done?
The symptoms which we have discussed earlier, if they notice any of them, they should immediately consult a doctor. They will visually inspect the cervix, and if there is any abnormality on the surface of the cervix, like an ulcer or the growth which you have described, they'll, under local anesthesia, a sample is taken, that's called biopsy from the tumor, which is painless. And once the test result comes as cervical cancer, then to know the extent of the cancer spread, we will do a test called MRI scan, and if required, PET CT scan to know whether it is spread to other parts of the body or not.
So, there are how many stages to this cancer?
Like any other cancers, there are 4 stages. In cervical cancer, there is a special stage called stage 0. It's called pre-cancerous stage, means the cancer is not yet fully formed. So we can detect this especially by applying the earlier screening tests. And other stages like stage 1, where the cancer is only confined to the cervix. In stage 2, the cervical cancer extends to the sides or below into the vagina to limited extent. In stage 3, the depth of infiltration or depth of spread will be more. In stage 4, the cancer is already spread to other organs like distant lymph nodes or the liver or the lung, etc.
I'm more curious to know about precancerous stage, like how is it treated?
Yeah. Our aim should be to detect the precancerous lesions by applying the screening test so that the complete cure is available. So the precancerous stages, after once usually detected by the pap smear, once the pap smear shows that there is suspicion of precancerous stage in the lesions in the cervix, we do a colposcopy, a special test called colposcopy, where the cervix is seen with a magnified lens, and we map the area and remove that area. That procedure is called conization or loop excision. If the same situation diagnosis is done in elderly women, one can choose to get the uterus removed.
And how are other stages treated?
The cervix cancer is completely cured in stage 1. So, if we detect the cancer in stage 1, a surgery is preferable where the cervix along with the surrounding soft tissue and part of the vagina is removed. Uh, if the stage 1 is diagnosed in an elderly woman, then radiotherapy is also an option for those who cannot undergo surgery because of choice or because of the comorbid conditions. In stage 2 and 3, as the cancer goes deeper, we treat them with radiotherapy and along with a small dose of weekly chemotherapy. As you know, this in stage 4, the cancer has already spread to different organs. So our aim is to prolong the life. So we use medicines like chemotherapy to prolong the life.
So, as a senior oncologist, have you noticed any development in the treatment of cervical cancer?
Yes. Of late, lot of newer innovation into the medication, especially immunotherapy, is available for the cervical cancer also. We use them in advanced stages, where in the stage 4 or stage 3. Also, to prevent the cancer, cervical cancer vaccines are available.
I would like to know much about the vaccine as to how safe is it?
Yeah. As of now, we have 4 types of vaccines available based on the varieties of virus it contains. The cervical cancer can be caused by many types of virus. The common types are type 16 and type 18. So, based on the number of varieties they have, these vaccine brands are available. This vaccine is also now produced in India by the Serum Institute. So, it is absolutely safe to take the vaccine except mild pain. Many people don't have any other side effects.
So, when should women take the vaccine and how many doses?
Between 9 and 26 is a good age to take, preferably between 9 and 14 years of age. If they take the vaccine 9 to 14 years, 2 doses will be sufficient. The second dose is given 6 months after the first dose. If one takes the vaccine beyond 15 years, 3 doses are required. The second dose is after the 2 months and the third is after the 6 months.
Can it be taken by boys as well?
Yes, the human papilloma virus causes conditions called viral warts. Also, sometimes gives rise to cancers in the lower part of the large intestine, the anal canal. So, to prevent these problems, one can take the cervical cancer vaccine. The schedule will be the same as we discussed earlier.
Does this vaccine give lifetime protection?
Yes, if the complete doses are taken and the schedule is completed, it offers lifetime protection.
Thank you so much, doctor, for this information and detailed insight about cervical cancer. So, as we know, it is preventable and there are vaccines available. I urge you all women to get yourselves vaccinated. And for further information, kindly contact the details given below. Thank you so much and thank you, doctor.